So many medications are overprescribed. The statistics are absolutely staggering. And we're going to talk to you succinctly about the worst offenders in terms of our own experiences. Which medications are the most overprescribed? Dr. Peter, do you want to go first?
Do I get a drum roll?
A drum roll, yes.
I would say, honestly, in my profession, so I'm a cardiologist, are beta blockers. All right. Beta blockers are a class of medications. They're tremendously used throughout the medical field. They're medications like metoprolol, atenolol, nebivolol, all these other, just a whole class of them. And so beta blockers often used for blood pressure. And even in the guidelines, they say it could be a first-line treatment for hypertension or high blood pressure. I just don't like beta blockers. I think the side effect profile, I've yet to meet a patient who feels great on a beta blocker. And in order to get good blood pressure control on a beta blocker, you have to get to escalating doses. And the beta blockers, they slow down your heart rate. They can lower your blood pressure, but not as great as other medications, but they cause fatigue. They give you that brain fog side effect during the day where you want to lay in a chair and you doze off. They cause a lot of just, taking away the pep you have, but also just the side effect profile. It really just knocks people down, and it really just holds them down. And people really, of all the blood pressure medications I see, that's overprescribed and people are over-medicated with it, and the side effect profile is just too high for blood pressure control and beta blockers.
Interesting. Yep. And every doctor will have their own perspective on this. So as far as you're concerned, then, I mean, obviously you're looking at it from a cardiology point of view. What would you recommend in a lot of people as the other categories for blood pressure management? What would you go for before you go for beta blockers?
That's true. I mean, there's lots of other medications. And so we really want to tailor the medications for that person. We always say that like one person doesn't fit all. So a class of medications, ACE inhibitors help protect your kidneys from high blood pressure, especially in people with diabetes. We know that there's a protective effect on the heart. They're better taken at night. They don't have as much as the fatigue side effect. Calcium channel blockers, it's not a bad option, especially as you get older. The side effect profile isn't all that much in the sense that it doesn't cause a lot of fatigue, lightheadedness. Well, I guess all blood pressure medications can cause lightheadedness. Everything is a dose-dependent effect. So staying on a lower dose of medications always offset side effects. Calcium channel blockers like amlodipine are bad for blood pressure. They can have an offset of causing ankle swelling, which actually can drive people crazy. Is there a great blood pressure medication? No.
And
is there one without side effects? No. Everything is a trade-off. But sometimes a trade-off outweighs any benefit that medication may have.
Very interesting. Okay. Thank you for that. I will go next. The category of medications that I believe is the most overprescribed: antidepressants. I'm really not a fan. I think that modern mainstream culture dishes out these medications like candy. I mean, I'm not a fan of a lot of medications, but antidepressants, I mean, I see a lot of younger people now who almost have a badge of honor about how many antidepressants they're on. And I think the medical profession is complicit in this culture because actually the truth is, especially for mild depression, statistics show that other things are actually way better than antidepressants, like exercise routine, getting outdoors in sunlight, getting involved in a hobby, even changing your food, cut back on sugar consumption. I've seen amazing studies on that. And I'm very skeptical of this brain, dopamine, serotonin, chemical theory of depression. I'll tell you a story from my life. I was actually in medical school, and I remember once I had a particularly long summer holiday, and I was very young. I think this was the end of my second year of medical school. I was like 19 or so. In the rest of the world, apart from the United States, we start medical school age 18. So I was very young and finished my second year of medical school, and I was pretty bored over the summer. And I, like a lot of medical students, started reading a lot of medical textbooks, and I started getting all these weird things in my mind at the time. Oh, is this wrong with me? Is that wrong with me? And I end up going to my GP. This was in the days, actually, it was very easy to see your GP. And he was a lovely man, but he talked to me and said, yeah, I think you might be a bit bored. Let's do perhaps these blood tests on you, make sure that there's nothing wrong. So I had a thyroid panel, complete blood count. Everything came back normal. And then he sat me down afterwards and he was kind of suggesting that maybe I needed antidepressants. I wasn't even a medication person back then. And I said, to be honest, doc, I think I'm just a bit bored. I need to get back to having something to do. And university starts again in 2 weeks. So I get back to university, everything's fine. But I always remember that, because had I been inclined in a different way, I think I would have been started on antidepressants. And I was like 19 years old. And now, like years later, it's probably much worse. Doctors are much more all in on this chemical theory of mild depression. But I was a very mildly, if anything, bored. But yet a doctor, someone with a medical degree, was trying to suggest I should be on antidepressants. And I remember that story. But nowadays, I think it's absolutely awful how people with mild symptoms are sort of sold the idea that antidepressants are the answer. And I'll tell you what, if you look at the studies, there's almost a 50% placebo rate, which means that if you give people an empty dud pill with nothing in it, a sugar pill, the fact that they think that they're taking an antidepressant makes them feel better. I don't buy it at all. Now, I'm not talking about severe depression or bereavement or where someone's like catatonic, but that's how I feel about antidepressants. I think it's ridiculous when I'm in the hospital. This has been going on for years. I will all the time hear people say, oh, that person seems a bit depressed. Let's start an antidepressant, as if that's like a magic help for them. I mean, even the studies show it takes 2 months for an antidepressant to work, if that. But I think when future more enlightened generations look back, they will think that was a complete and utter scam.
I totally agree. So the antidepressants, they can be just really dirty medications. And so again, for severe depression and severe, mental health issues, they play a role. But in the general population, they increase serotonin in your body, a lot of them. And that increased serotonin has a lot of effects on the body, including weight gain. So I see patients a lot coming,
Sure.
They don't know why they've gained weight. And some people have significant weight gain, and it's really from the increase in serotonin. They alter your metabolism of your body. They increase your appetite. It can lead to obesity. It also just has like a blunting effect on a lot of, I think everyone probably needs some motivation or stress to exercise regularly, and having especially higher doses of antidepressants take away that kind of like that drive to really exercise and get out there and try to do something more healthy.
Well, I think if you haven't tried those things yet, if you haven't tried exercising, if you haven't tried changing your diet, if you haven't tried working on that thing or those things that appear to be kind of affecting you negatively, and you go right to a pill, I think it's very unlikely the pill is going to do the job. I mean, you have to focus on that stuff first before you even think about it.
Exactly.
In my opinion.
Yeah, and the pills are going to have all sorts of other side effects. As you said, weight gain, I think that's a huge part. I mean, obviously, eating enormous amounts of food and being completely sedentary are more of a factor nowadays anyway in young people. But I think it's so sad that nowadays a lot of young people think the answer to their depression is to be on a pill, when actually no, it is to stop your screen time, get up, get moving, get a hobby, interact with real people, get out in nature, get some sunlight, stop eating crazy amounts of sugar. We have gone so badly wrong. I mean, this could be a 2-hour podcast, but the spiritual health crisis as well in young people, in them feeling just so terrible, and then it leading to this vicious circle of poor health, frequently weight gain, other issues. I mean, the younger generation is so lost. I mean, we're speaking like, obviously, 3 like 85-year-olds, no offense, because there are maybe some watching fantastic 85-year-olds who are looking back at the younger generation, but wasn't that long ago, when we were that age, and things were, I know I gave that story, but I can tell you it's 10 times worse now, years later, with doctors who are prescribing antidepressants for very minimal symptoms.
Oh, no, I couldn't agree more. I do think there was the time when people looked to their doctors to say, hey, you need to fix everything that's wrong with me, is potentially coming to an end. I do think there is an enlightenment we're coming to where people are realizing they need to take health into their own hands, and that doctors are, like many other things in life, a tool. And they can, seriously, a tool, their advice. Again. But like many other things in life, they're one thing that you can use on your journey to health, but you have to take it into your own hands. Otherwise, it'll get away from you.
True.
It's not really coming to the underlying cause, right? I mean, just cognitive behavioral therapy.
Yeah.
It's really just working out, like, why are you feeling depressed? Work out that, because really the antidepressants are really just like kind of giving, like, blanking the memory, just trying to, it's suppressing. It's not really treating. And so, I agree with that.
And don't get me started on, we are so comfortable now compared to previous generations. I mean, previous generations went through Great Depressions, famines, world wars. None of them needed antidepressants. I'm not saying that times weren't tough, but how did they get through? I mean, many of you watching, I'm sure your parents, grandparents, world wars, terrible things, and they all got through it. And now it's like, oh, I'm a little bit anxious or depressed. Let's go for a pill. But anyway, I'll finish with that because I know Dr. Ben here wants to talk about his category of medications.
Well, it's not really a category of medications that is necessarily overprescribed. I just think it's poorly prescribed. And that's diuretics. So if you've heard of these medications, they're the ones that they're called the water pills, the pills that make you urinate and try to get all the water out of your body. These are typically prescribed for liver failure, heart failure, kidney failure. People give them to you to try to get excess water out. So a really common scenario is you come in, your legs are filling up with fluid, you're having trouble walking, and your doctor throws you on one of these pills. And the problem I have is so many people are put on these, they're not monitored correctly because they can cause things like potassium and sodium to go down. So you have to watch and make sure a person's potassium and sodium are okay. And a lot of the time, people will develop a condition called lymphedema in their legs where it's just kind of chronically very swollen, and they keep throwing higher and higher doses of these water pills at people, and it's not doing anything except for putting you at risk. So, I have a huge problem with diuretics, the way they're prescribed, the monitoring that goes on, and the thought process behind them. I think there's minimal effort to figure out why you're swollen and have edema, have fluid everywhere, and a lot of effort goes toward throwing these meds at you and putting you on ever higher doses. That's what I see.
I totally agree, Ben. It's they're not monitored correctly. And I always try to tell my patients, diuretics are a little bit like insulin. People are put on a fixed dose of diuretics. So common diuretics were like furosemide, Lasix are probably the most common ones, torsemide. And people sometimes are dehydrated and need less of it. Just like people with diabetes, sometimes they need more insulin, sometimes need less. No one usually with diabetes is on a fixed schedule, the exact same amount of insulin all the time. It's so environmental. And so I see patients that are dry as a bone, and sometimes you almost feel like their tongue is like stuck to the side of the mouth because they're so volume depleted or dehydrated. And really that's a problem. And so it's just not talked about, the monitoring of this, and just the low blood pressure can cause electrolyte derangement, which can cause arrhythmias, muscle cramping. I have people that come in to cramping at night in their legs, or their hands cramp up. And so it's potassium, especially also magnesium, is often underchecked in diuretics.
Yes. Oh, absolutely.
Yeah, that's right. So we're talking about medicines like furosemide, hydrochlorothiazide, any other common diuretics?
No, as I mentioned, and torsemide, probably the most common ones. There's other ones like spironolactone. They're not prescribed as commonly, but they do play the role. And again, we're not saying stop your diuretic. It plays a role in people who have congestive heart failure or some other chronic heart conditions that need it. But it's just like, be careful when you're on them, because as much as they can help in some people, they can be very, very dangerous and unsafe if not monitored correctly.
Yeah. Thank you very much for that. Okay, everyone. We hope that you benefited from that. As always, speak with your doctor. We know how difficult it is to find good doctors out there, but don't stop looking. You owe it to yourself and your family. Health is the goal, obviously, as naturally as possible. And medications are a last resort. I mean, we went to medical school thinking that people get sick, we give them medication, and then they get better, and that's it. But the whole paradigm has shifted into this chronic disease management, pharmaceutical industry making billions of dollars forever and ever. And we don't believe that that's the way medicine should be. So thank you, everyone, for watching. We're rooting for you all to succeed. Check the links in the description down below for our separate, unique channel where we post a lot of exclusive content. Also, our natural health and well-being store, ohiwellness.com. If you're in the USA, North America, ohiwellness.co. If you're in the UK, Europe. Keep going, everyone. Stay well, and we will speak to you again in the next episode.